Hi, my name is Mary Gover. I am the Associate Program Director for the Primary Care and Social Internal Medicine Program, and I'm really excited to talk to you today about the program and the clinical experiences that you'll have if you come to join us. So my favorite part about working in this program are my colleagues, and I include the residents in that statement. I came to the program actually as a resident, as an intern. I stayed to be the chief resident, and I've stayed ever since. So I've been working here for almost a decade. The backgrounds and interests and attitudes of the faculty colleagues and the resident colleagues keep me really excited and energized to come to work. Working in healthcare today, working in primary care, there are days that can be challenging, but there isn't a day that goes by that I don't come to clinic and hear something interesting that one of my faculty or resident colleagues is working on, have a great conversation with one of the nursing staff, one of the front desk staff, one of the security guards, and feel that kind of human connection that really makes me feel excited to come to work. And that's, I think, why I came and definitely why I stayed. So the site where you'll practice if you come to our program is a community-based health center in the South Bronx that was founded in the 1960s as part of the Community Health Center initiative at that time. And it was actually one of the first health centers in that initiative. So it's had a long-standing history of providing community-based care in that neighborhood. The location where it sits now is on 161st Street in the South Bronx near a major thoroughfare called the Grand Concourse. So it's on a bustling commercial hub. It's between two neighborhoods, Morrisania and Melrose, and the composition, the communities in these neighborhoods are populations that are about a third Black African American and about 2/3 Hispanic, with a rich history of community activism and community support. In addition to the standard continuity clinic that all residency programs have, the clinical experiences that you will have at our health center go beyond that. We have partnerships that try to establish relationships with communities and populations of patients that have a harder time accessing care. So one of the unique experiences that you will have is a clinical experience with people who are recently released from jail or prison and are seeking to reconnect to health services in their community. So this is a clinic that works in tandem or in relationship with a community-based organization that provides really comprehensive services for people who were recently released from jail or prison who are coming back to the South Bronx community. We have a strong relationship with that organization. And when people come back into the community, one of the community health workers from that organization reaches out to us and lets us know that someone has come back and needs health services. We have a dedicated time each week for our residents to be able to see these particular patients who need to have access to our clinic. The resident will have a session seeing about 2 or 3 of those patients, ample time to really get to know the patient, to really do a nice intake and build a relationship. And then that patient who they met that morning will be part of their continuity panel and will continue to get ongoing services with the resident in the clinic. We also have a very robust relationship with the community-based organization that seeks to improve the health of recent immigrants, particularly immigrants from West Africa. And these are longitudinal, unique experiences that you'll have at our clinic during your residency program. I really want to make sure you all understand how much we find resident supervision and mentorship to be important. And so the first relationship is a paired relationship. Each resident has a specific faculty member who they can go to talk about their clinic continuity panel, to talk about labs that need to be discussed and questions about the clinical management, but also to understand how the clinic works, the workflows that are unique to our site, any type of clinical mentorship. Each resident has a specific faculty member to go to for that, and we call that the box buddy pairing. The other relationship that I wanted to talk about is a little bit less formal. It's a relationship that exists because at our clinical site, the faculty work right alongside the residents. So there are 30 residents who come to our site, 10 per year, and there are about 20 faculty. And the faculty include your residency faculty, so I work there and Shweta Iyer works there. Other core faculty for our program work at our site. But there are other unique faculty who are integral to our program who work there. So many research faculty who do harm reduction research in our Division of General Internal Medicine work at our site. And each day when you come to clinic, you'll be working in exam rooms right alongside the faculty. There's a really strong collegial spirit at our clinic. You can rub shoulders with faculty who are doing research in areas that you find interesting, build a working relationship with them, and then go on to work with them on research that you want to collaborate on. So it's a really dynamic, warm, and collegial place to work.